Hello everyone, I am Dr. Purvi Kadakia Kutty, Consultant Pediatric Hematology and Oncology at Apollo Hospitals. Today we are going to address common concerns which come across the table when we deal with a family who is giving chemotherapy to a pediatric patient for a pediatric cancer. So what are the concerns the parents come with? The commonly worries which the parents have is, doctor, what is chemotherapy? How is it going to affect my child? What are the side effects? Everyone has the major concern is, what are the side effects of chemotherapy? Why does my child need chemotherapy? And how do I prepare my child for the chemotherapy? So what is chemotherapy? It's basically using cytotoxic medications or injections which are given to a child who is diagnosed with cancer. These injections, as the word suggests, they are cytotoxic, so they kill the cancer cells, as cancer cells are rapidly dividing and we need to attack them fast. So these drugs are given in a standardized protocol over a number of days with a break in between the cycles, and these are given to treat various types of cancers. Now if you ask me, why does my child need chemotherapy? So the main concern is to treat the cancers. There are some cancers which are the liquid tumors, so cancers of the blood and the lymphatic system. They are treated purely with chemotherapy cycles. It's an intensive chemotherapy cycle. Sometimes the drugs go on for over 2 years. Sometimes they are short cycles over 6 months, which are given 3 weekly. So it is protocol based in each individual case depending upon the diagnosis. Now, these chemotherapy cycles have to be planned in a way taking into mind the weight of the child, the diagnosis of cancer, and why is it needed. As I said, blood cancers, we give only chemotherapy. Sometimes if there are solid tumors, for example, tumors of the kidney or the liver, we give the chemotherapy to shrink the tumor so that the surgeon finds it easier for it to resect. The tumor becomes easily resectable without much of tumor spillage. So we shrink the tumor by giving or preparing the child for his surgery. Many a times chemotherapy is given, for example, in brain tumors along with radiation. So when the child is getting his radiation over 6 weeks or 4 weeks for his brain tumors, we give a short dose of chemotherapy which will act as an adjuvant so that these tumors respond better. Sometimes, unfortunately, in end-stage cancers, the chemotherapy is given as a palliation. So they are oral drugs which reduce the signs and symptoms of the cancer, which will reduce the pain and also improve the quality of life if it is an end-stage cancer. The main concern is how the chemotherapy is given and what are the side effects. So moving on to that, chemotherapy is mainly used intravenously. So we inject the drug in the vein, and sometimes it can be given orally. Many a times in blood cancers in children, the chemotherapy also has to be given intrathecally, that is in the spinal fluid. Because we want to prevent the spread of the blood cancer to the brain. So this is a specialized way of giving the chemotherapy. Now what are the side effects? As we know that chemotherapy is cytotoxic, so it will immediately act on the rapidly dividing cells, that is the cancer cells. But what it does, it also acts on the rapidly dividing cells of the normal tissue in our body. So the skin, the hair, the lining of the gut, the oral cavity, and the bone marrow cells. These cells in our body are rapidly dividing and they have self-renewal property. So the chemotherapy agents can also affect them. So commonly we see there is nausea, vomiting. Children get oral mucosal ulcers. So they have mucositis. They have pain while swallowing. Sometimes they may present with diarrhea. Then they have changes in the skin and hair. There is hair loss, there is depigmentation, there is hyperpigmentation. Also, commonly seen, which is a major concern with us, is the hematopoietic toxicity. That means the blood cells also get affected. So there may be a drop in hemoglobin or platelets and the WBC. So these patients may require blood support. And major concern is fever, because if the WBC count goes down, we have to keep a close watch on that. So these are the common acute side effects. How we tackle that? The protocols are kept in such a way that there is a gap given between chemotherapy. So usually within 2 weeks or 10 days, depending upon what drugs have been used, the child will recover. So we give a period of recovery in between the 2 chemotherapy cycles, which is safely planned as per the protocol to prevent these side effects. And we also give them some antibiotic prophylaxis if they require injections to bring up their WBC count. Another concern is the long-term side effects, which is worrisome in children because they are as such growing. Many of their organs are immature, especially the liver, the kidneys, and these 2 organs are the ones which are going to bring out the chemotherapy drugs. So they excrete these drugs. So if there is an immature liver or an immature kidney, the doses have to be adjusted. Some of the chemotherapy drugs have an effect on the heart. So we need to monitor the cardiac functioning. Some of them have a side effect on the hearing. So children need to be prepped up before giving the chemotherapy to bring down long-term organ side effects. There is also a very high chance of infertility if a high dose of alkylators or special kind of chemotherapy drugs are used. So that has to be kept in mind. And there is a minor chance of secondary cancers because of the chemotherapy. So the implication is not only acute or short-term side effects, there are also long-term side effects with chemotherapy, which we need to keep in mind. And as pediatric cancers are curable, we have a lot of long-term survivors. So we have a planned program to follow them up for side effects of chemotherapy. Another major concern is how are we going to give the chemotherapy to my child? Will he tolerate it? What do we need to prepare the child before the chemotherapy? So the most important thing is the diagnosis, that it should be a complete diagnosis what cancer we are dealing with, and then we plan the chemotherapy. So before we plan the chemotherapy, child is completely screened. Not only the organ functions are done, his hearing is done, his cardiac functioning is done, his immunity status is done, his vaccination status, what he has taken in the past, everything is kept in a record. He also goes in for a dental fitness because chemotherapy has an impact on the dental hygiene. So all the pre-chemotherapy workup is done. Then we plan for the chemotherapy. In children, usually a minor procedure is done. So they have a port instilled, or they have a long line through which the chemotherapy can be given. So it's a chemotherapy port or a chemotherapy catheter is installed before we start the chemotherapy. What this does is it prevents the child to get repeated IV pricks. So they will not get multiple injections, which will be painful. This port can be used again and again, and the drugs can be instilled, and usually a staff or a nurse who is trained in handling the port will handle this child. As I mentioned, this nurse or the sister, she is a crucial link between the family and the child in giving this chemotherapy. She teaches the parents how to take care of the long lines, how to instill the drugs, which drugs can be given slowly, which drugs have to be given over an infusion, which drug has to be given subcute. So the nurse or the daycare sister, she forms an important link in giving this chemotherapy. Many a times, chemotherapy drugs need to be given orally, when especially in blood cancers, when the child finishes the intensive phase. So there are some instructions how the chemotherapy drugs have to be given orally, what precautions the parents have to take. They have to take care of the oral hygiene, and as well as the if there is vomiting, what medications they need to give. There is a red alert when the child has fever on chemotherapy, immediately they are instructed to report. So these are the common concerns and how we prepare the child for chemotherapy. After that, just a little bit on how chemotherapy differs in a child, because a child is not an adult and the chemotherapy doses as well as the protocols have to be planned in a separate way. They need to be based sometimes on the child's weight and not on the body surface area. If the child is just around 1 or 2 years old and less than 10 kgs, then chemotherapy drug doses need to be reduced as the side effects can be alarming. So if anyone has any further queries on the facts and myths of chemotherapy, you all can get in touch. We are available online on Apollo 24/7. Thank you.